In this episode, Dr. Maram Museitif shares what it means to be a first-generation college graduate, a Palestinian American public health doctor, and the empathy princess in systems that weren't built for her. She talks about fighting for the chance to go to college, becoming the first doctor in her family, and then watching her sister, niece, and cousins follow, turning one act of courage into generational change. She also speaks honestly about being a visibly Palestinian hijab-wearing woman in predominantly white spaces, about being misjudged before she even speaks, even being asked if she speaks English, and still choosing to lead with empathy, evidence, and conviction. And she shares a bold vision rooted in hope, rebuilding trust in public health, expanding access to care, and creating a future where the next generation doesn't have to fight as hard as she has. You're listening to the Courageous Public Health Podcast, episode 36. To all the courageous women leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I am an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have real, unfiltered conversations with women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then listen to this new episode. Thank you for joining me on this episode. I'd like to start by introducing myself if you're brand new to the podcast, or reintroducing myself if you're a returning listener. My name is Dr. Christy McClamrock, and I am the CEO of the Courageous Public Health Consulting Firm, where we support public health organizations through workshop design and facilitation and speaking engagements. I am so excited to introduce you to my guest on this episode. Let me formally introduce her, and then we'll jump right into our conversation. Dr. Maram Museitif is a public health doctor, cancer researcher, and strategic leader with over a decade of experience in health policy, cancer prevention, survivorship, healthcare delivery, and health systems innovation. She is a postdoctoral associate at the University of Florida College of Medicine, where her research focuses on HPV cancer prevention and implementation science in rural counties. Beyond research, Dr. Museitif has dedicated her career to reducing health disparities and strengthening community health systems. She serves on the Central Health Board of Managers in Austin, Texas, shaping care for the safety net population and improving access. She previously chaired her community's School Health Advisory Council, where she advanced health and safety initiatives for students. She's also served as a City of Austin Human Rights Commissioner, reflecting her deep belief in civic duty and public service. Her career spans local, statewide, national, and international roles, including work with Yale University, UT Southwestern, the U.S. Department of Veterans Affairs, the Texas Department of State Health Services, and the United Nations Relief and Work Agency. Her leadership and service have been recognized with honors such as the Top Healthcare Leader Award from the National Healthcare Diversity Council, the Ascendant Award from Leadership Austin, and the Jesse A. Yoas Memorial Advocacy Award from the Texas Public Health Association. A first-generation Palestinian American, Dr. Museitif leads with empathy and courage, shaped by her personal journey and professional path. With a deep breadth of experience spanning research, policy, governance, and community service, her mission extends beyond cancer prevention to bridging public health and healthcare, advancing health equity, and building systems that ensure every community and person has the opportunity to thrive. Are you ready to be inspired? Let's listen to my conversation with Dr. Maram Museitif right now. I am very excited to introduce my guest, Dr. Maram Museitif. Welcome to the Courageous Public Health Podcast.
Thank you so
much. How are you doing? We've been having some technical difficulties behind the scenes here, but we're going to get this. We're totally going to get this.
Technology is great when it works. Well, thank you so much for having me. Really appreciate it. And thank you to Zainab for her recommendation. Deeply appreciate it.
She said, I asked her, if she had some ideas of other courageous women who might be interested. And she said that she didn't know you directly, but follows you on LinkedIn. And that was really great. And now I get to follow you on LinkedIn as well. So it's a win-win, win-win-win.
Yes, that's wonderful. It's funny. I used to be very active on social media, and when I get to meet people, and they've been following me for a long time, when they get to meet me in person, like, you're the same person. So I'm like, I am so glad,
right.
There's that authenticity. I am who I am.
There's the authenticity. Exactly.
So yes, it's been great, the social media connecting people from all across the world and building these connections and relationships. It's been amazing. I have friends all over the world and built really strong connections and with like-minded individuals. And it's been amazing, the opportunities and the connections that we've built.
I know, and it's almost easy to take it for granted because it did not used to be this way, right? Like, it wasn't that long ago that wasn't a thing, right? This is
it was not. And getting to meet people, like, I know, like, we all have, Facebook and Instagram and tailoring it to all different audiences and connecting with our family members we never knew they existed, and now
right
here they are. But it's been really great. We've been closer and closer and more connected. So
nice. Yeah,
been great.
That's good. So I want to start by giving you a chance to introduce yourself to our listeners.
So I am the Empathy Princess, as my friends from the universe have really named me. I'm also
the Twitterverse, is it?
The Twitterverse or the Xverse. I don't know what it's called.
The Xverse. I don't either. I don't know what it's called.
So, it was really an honor when my tweets at that time created a hashtag for me, and it really resonated from kind of the communications that we were communicating, the topics, the opinions that we shared. I'm also a first-generation college student. I am a proud Palestinian American public health doctor. So I am more, and I am I'm a mom. I am a leader in our community, a scientist, a cancer researcher. So we are many, but most importantly, I am a woman here who's really trying to pave the path for others to lead and to pursue higher ed and public health.
Yeah, that's so incredible that you are talking about being a first generation college student. Like, that's a big deal. That's a really big deal. That's a generational big deal.
Yes.
That's really powerful. Yeah.
Oh my.
Okay. Yeah. Were you going to say something? I didn't know if I cut you off there.
No, and being a first generation college student, really, so much pride in it. But it was it brings me tears when one thing I get really emotional is whenever I witness college, graduations, I bawl because that was a dream of mine, and now here I am. I've attained that dream. So it holds in, yeah, it is everything to me.
Yeah. Yeah, well, I want to jump into the first question because I suspect that, this is something that you are going to talk a little bit more about. So, I always like to start by reminding the listeners that bravery is taking action without fear, while courage is taking action despite fear. And so, yeah, I would love to hear some experiences from your professional and your personal life where you've acted courageously. And certainly, being a first generation college student, that's an act of courage.
Yes. So on a personal level, just
Yeah.
mentioned being a first generation college student and really fighting for it. Going to college was not a given. It was
Yeah.
really a challenge that I had to fight for. So typical within our culture and society is that our parents will send us overseas to learn more about our culture, our language, our religion, and that's it is. So my parents sent us, me and my siblings, to live in the West Bank in Palestine. That's where I graduated high school, which was one of the best times of my life. But after, I was really the salutatorian of my school. All on my mind was really doing great, excelling in school, and going to college. That was not the plan for my grandmother at that time, but
Yeah.
all I wanted is to come back to the States and pursue my education. And there was some resistance from my parents, especially my dad. He was fearful for whatever reason it was, because I was the first, even though I'm a second generation American.
Yeah.
He later on caved in, and we moved all back to the U.S. and I pursued my undergraduate at the Ohio State University, which was one of a really great opportunity, great time, but it was very challenging. I did not have a role model. I didn't have a mentor. I was trying to figure out things on my own. And yes, it was American, but also there was that cultural, shock. I'm like,
Sure.
here I am. It was all new to me at that point. But all I had in mind is, I'm here. I made it. So being there, and
Yeah.
I remember days, sometimes I'm just walking on campus and I'm like, this is surreal. I'm in college. This is it. And so yes, so that was really one of the most challenging parts, is convincing my parents, primarily my dad, that I wanted to go to
Yeah.
school. And I fought for it and I graduated, and here I am. I am the first also to be a doctor in my family. So it has been a great and challenging and wonderful experience, but it was very difficult.
Yeah. Yeah. I mean, I'm sure that as you said, it sounds like your father had some fear, and that makes sense. And that you didn't just fight through your fear, you fought through his fear too, right? To then, you know, do
Yeah,
this thing that was really important to you. I think that's amazing. It's really, really powerful.
and even the work I did as an undergraduate,
Yeah.
I was an undergraduate research assistant in the psychobiology lab running animal models. I am very fearful of anything furry, but yet I was running rats in the lab, performing perfusions, dissecting their brains, freezing their brains, histology, histological work. That was also my inner fear and my courage. I'm like, I can do this. There's
Yeah.
science behind this work, and that really
Yeah.
led me into clinical space and into clinical research afterwards. But again, it's overcoming our fear and our challenges. So that's on a personal level. On a professional level, being the only person who looks like me, who is of my background in the spaces that I'm in. It takes a lot sometimes, when you are the lone voice and may not understand or can relate to the experiences you have, and also realizing how hard it took you to be where you're at. The challenges that I even had to endure just to have a seat at the table from the moment that I completed my undergraduate work, my master's, and here I am, is I earned this seat, but yet there's just showing up. It takes a lot of courage. I remember once a very powerful individual, came up to me once and said, "How do you feel that you always stand out?" And I really never thought that I did. I'm here. But then I paused for that moment and I said, it's empowering. People know I'm here. So, and that's how I'm able to really reflect on taking these really difficult situations and turning it into something more powerful and meaningful, and leading with those. And it weighs on you at times, but yet there's that inner fire, that fear, just that resiliency. I need to be here, and remembering my why. Why am I here? Why am I doing this work? And that's really where I get grounded to and turn, and it really empowers you in ways that you don't know how.
Absolutely. I think that, it feels empowering to me to practice my courage. That is an act of empowerment, I think. I'll probably cut this out for myself because I'm not sure exactly where I want to go here, but let's transition to the next question here. So courage is also about authenticity and claiming and expressing your power, especially in spaces that might not always welcome it, like you were just talking about. And we've already been talking a bit about authenticity even before we hit record. We had a conversation about authenticity, and so I'm really wondering how you express and embody your authenticity and your courage, and thinking about some of the challenges and maybe what strategies have helped you navigate those challenges.
Well, it's about being you and sticking to that core principle and leading with the principles with integrity and doing the work, whatever it is, a task, and really being your true authentic self. It is there's power to it. There are things that I'm not, if they're red lines, I will not compromise. If it's on a professional level, like things that I really care and dear about. When we're talking about public health, I can't, we cannot compromise health and inequities, and that is the core principles of the work we do. We need to target and tailor programs for people because not one size fits all. So those are things that I'm not willing to compromise. I'm not willing to compromise building or creating or developing a program without really having the patient, the community's voice at the table. It is really, and also being present at the time as well.
Yeah. Yeah.
So it is, again, it is really primarily who you are, and when people can see it. And same example, Zainab probably, she
Yeah.
connects with us,
Yeah.
and I never met her in
Yeah.
person, but here she saw what I wrote, and here you're hearing, what I am, and where people even
Yeah.
say you're the same person online and offline, and
That's
also,
such a great compliment, actually, for someone to say you're the same person, like I'm meeting you in person. It's like, oh yeah, you're the same person that you are online. I have to say that is such a great. I think that's a huge compliment.
well, thank you. It is. Lives have a short-term lifespan. People can, and if you're
Yeah.
bragging or whatever you're saying, or you're not preaching what you practice. If I'm talking about vaccines, for instance,
Yeah.
if I am not vaccinated, or I don't vaccinate my children, or I don't encourage vaccination, how can I do the work? How can I encourage others or recommend vaccines? How can I somehow nudge the parent? Hey, the importance, the significance of these vaccines. Vaccines are safe, they're effective, they save lives. So it is
Yeah.
being true, the authenticity in what you believe in, and who you are, and walking, the walk, and that is just
Yeah.
in being you. There's no need to be someone else that you're not.
You know, I mean, I love that you're saying this, and it's also, it is a difficult time to be you. I am assuming, and you sort of spoke to this before, like this is a particularly challenging time for you to put yourself out there.
Oh, absolutely. As you know, first and foremost, I am Palestinian,
Yeah.
and I am also American, but also knowing that
Yes.
what my people are going through, what my family members are going through, being up all night checking the news, calling them, and worrying about if they're alive or not, and seeing children who are being starved to death, aid not being served. And this is also, it's personal and professional as well. So it weighs on me to
Yes.
a point, but yet I'm limited, let's say, to what I can say and express. But one thing I can't hold back or take back is who I am. This is who I
Yeah.
am. This is my DNA. This is my blood, my roots, and you should accept me for who I am. Yes, I will be very frank and honest. I did lose opportunities just because maybe of my ethnic background, and
Yeah.
what the assumption is, and I don't know. And if you follow or you see or you've been around me, you've heard, it's really about bridging and building this human compassion of hearing others, of connecting one another, because our needs are the same. Our
Yeah.
aspirations are the same. Our concerns are the same. I'm very involved in our school district. I was the chair of the school health advisory committee of our school district, which is predominantly white, more affluent individuals at the school. But
Okay.
here I am, the only one who is,
Yep.
but covered in Muslim and whatever background. Probably I'm the darkest in the community, but yet
Yeah.
I'm able to build these bridges with the mothers, with administrators, with connecting all in the cause of health, because we all care about the health and well-being of our children, and
Yeah.
that is how we can build human connection. Is really listening, engaging with one another, connecting with one another. I have a dear friend, Nick Atkin. He actually, what he does for human connections, he passes these really cute, fun pink socks. He gifts them to
Ah.
strangers. And the whole
I
point,
love that.
and the whole point of these socks is once you wear them, it really sparks the attention of someone else to ask you about the socks, and you've built a connection with a complete stranger. And that's how we should be. It's just you just connect. Come, listen. Don't,
Yeah.
assume I am someone who I may not be, or sometimes I get the notion, oh, do you speak English? Or sometimes because of the
Right.
way how I look or to connect.
Yeah.
And again, I just hope and pray that people can really understand the suffering of individuals and the pain they carry on, because there are days and moments that it really takes a lot to just get up, and that yet you're supposed to get up, wipe everything, nothing it existed, and carry on with your life as normal. And that is the weight that not just me, so many others have been bearing. And what I'm hoping that we can pause for a moment and put ourselves in people's shoes. When I speak about empathy, is really put yourself in that individual's shoe. And that's how we can build really a trusting relationship where we connect, and overall we want to build a healthy society that embraces and welcomes us all into it. And that's the beauty of the world that we live in. And we all have, imagine if you're eating a bowl of salad, it's just cucumbers. It's going to be tasteless. Not everyone likes cucumbers, but having a variety of different flavors and taste and connect. If you've heard about this before, but here I am. I'm doing really impactful work on so many different levels, and yet I'm sometimes not being seen or heard for whatever reasons it can be. But that's where we're talking about courage, resiliency comes in, and remembering our why. What is our why? And
What is our why? Yeah.
I remember during my dissertation, just to keep me sane, I'll have all these sticky notes and affirmations and reminding myself why I'm doing this work. And when I remember why I'm doing this work, it just it motivates me to continue on, even though it may not be easy. But I know I might make a difference in someone's life, and I have heard it directly from folks. It's like, you're the first that we ever met. And building these bridges. And that is really what I'm hoping we can do. We need more of us being present, being at the table to build this level of trust, a level of compassion, a level of humanity, that you're human. We hear you, we see you.
Yeah.
So that's really what I'm trying my best to do, and it may take one person at a time.
I love the idea of you having sticky notes with affirmations like peppered throughout your dissertation. So anyone out there who's working on their dissertation, like, that could be a really cool thing, is like pepper. Oh, phone. Sorry. Should put it on Do Not Disturb. Is to pepper some affirmations throughout. I love that. I love that you did that. And I love the socks. Nick Atkins, you said?
Yes, you can find them #pink socks.
#pink socks.
Yes.
And also, you showed me before, you had some empathy. Were they pins? Empathy,
yes.
or like,
My
show
empathy
those, because those are really great too.
So really, it's really stemmed from my experiences and work, and trying to really dive in to dissect what is empathy. It was usually a buzzword or whatever it is, or it's a forbidden word for, and it's embracing mindful possibilities, allowing, trusting, heartful yielding. It is really listening to others, allowing different possibilities. And ultimately, we want to build these trust, because no one is alike, but we should be able to embrace one another and welcome different ideas, different perspectives. And that's, once we do that, we are able to make a huge difference in this world and ultimately improve the health outcomes of people. And that's really what matters in reducing these health disparities. If we're not being mindful of the different possibilities, how can we really do the work effectively and efficiently?
You have empathy princess pins. I think that's fantastic. I really like that. I really like that a lot.
Yeah, I should send you some.
You might have to send me one of those.
Oh, yes, for sure.
I'll give you my address afterwards. Okay, so Maram, I want to also have a few minutes to talk about your vision. I always like to end our interviews with this particular topic because I think vision it's so very important, and vision is what tells us where we need to have courage, right? Like vision informs our courage. So I'm wondering about your vision in terms of public health. I'm wondering about your vision in terms of your community and communities. And then, of course, I'm wondering about your personal vision for your own future.
So my vision that we are all living a healthy life, that, but it is also a vision that we can trust public health, that we can build on this trust in how we can communicate the information in a way that resonates with individuals, that we meet individuals where they are, and being very mindful of the stage of where they're at. And we have witnessed miscommunication around so many different topics, which really has resulted, unfortunately, in very bad decisions. Or if we're talking about vaccines, vaccine hesitancy among parents. And we know the science really supports it. And where within even COVID, during that time, there was a lot of misinformation, where folks are no longer really trusting us. And my vision is that we can build a culture that trusts science, that trusts evidence. That is really my vision, hope. And it starts by one person at a time, unfortunately, now, because one message cannot be, it's not sufficient. It needs to be really tailored to the individual's needs and where they are at. And also the vision is, folks, even whoever you are, whatever background, whatever experiences you have, don't let no deter you. That should excite you more. That should bring the fire in you. And I know, I've had more rejections than acceptances. It either is in work or personal or whatever it is. But that rejection is a redirection. And I am really happy and pleased to see right now, as being the first in my family to pursue a college degree and earned it, and earned multiple degrees, a wall full of degrees, that now
you didn't stop at a bachelor's degree. You kept going.
No, I still want more. I am not, I don't know really, I don't think I have achieved what I wanted. I still need to achieve that. I did not. I don't think I've made the difference that I want to. But I'm also very proud and happy to know that my niece now is attending college. She's a freshman in college. So to me, that pride, like, wow, finally, someone from my family. And my sister actually also completed her degree as well. So I'm witnessing my cousins are, pursuing college degrees. They're professionals that I know I was the first to lead it, but I paved the path that it has become the norm for everyone to go to college, and it's encouraged. And to me, it's heartwarming. And the vision also, when I saw within my community, I really didn't understand at the moment when, we're talking about dissertation. During my dissertation, I still have PTSD. I really didn't think about the amount of the impact that it will be amongst my community. And the moment when I graduated, and I cannot tell you, it was during a really difficult time for me. It was a time that I really had to find the moment, I needed to find the motivation to continue on, because I felt I was on the verge of collapsing. I could not do it. But I also remembered my why. Why am I doing this? And I did it for the children of Gaza, Palestine, and I dedicated it to them. And I knew that perhaps one day they will never earn a degree. They may never go to school, but here I am. I'm doing it for you. And that really gave me the courage to continue on. And I'm very proud that I graduated, honors in my class. And it is very fulfilling to see within my community. Now when they always ask me what's your views, and when I'm out in the public gatherings, and sometimes it's like I feel, I get blushed. I'm like, hey, you're doing this, but I really never really sensed or knew what I was doing until I saw it in their eyes, and it is truly heartwarming to see that people can see the possibilities through me. And I'm happy that I'm not the only one, and there's others who are leading the path.
I mean, now you have a sister with a college degree and a niece who's now starting, like, that is generational change. I mean, that's amazing. That's impact right there. Like, that's you making an impact. I was getting chills when you were talking about that, about your niece. I mean, that's...
I'm, so proud of her, and I'm really hopeful that she will, do great things. And I'm also proud of my own kids and the leaders they have become, and the work they have done, and being able to... When they tell me, I was actually invited, my daughter invited me once to her school to speak. And I'm like, I was reluctant. She's like, no, you need to come and speak. And I'm like, what am I going to say? She's like, just talk about anything about public health, your journey. And I was worried because, she's my critique, my judge. But I didn't really realize the words that I shared, just sharing my authentic self with others, and the experiences that I was able to inspire these young students who were about to go ahead and compete on an international and a regional competitions, who actually wrote back to me and saying, thank you, your words inspired me. And they wanted me to write a book. And they're actually...
Oh my gosh.
And I'm like, waiting for the book. They actually just reached out last week. It's like, did she publish her book yet? And I'm like, what it is? It was just sharing a journey, and the journey of turbulence, but a journey that was led with purpose. So that, to me, is also a vision, seeing that the impact we can, and that we are able to make a small dent in this world.
Yes. And what amazing modeling for your daughter about authenticity and and showing her your authenticity and your courage, and that's beautiful. I think that's really beautiful. Well, is there anything about your personal vision, anything that's like next for you, coming up for you?
So we shall see, to BD. There's I have there a lot of thinking, and I think right now I've reached a point in my life that whatever I want to do is something that is fulfilling and enriching, that I'm able and really working with purpose. I don't want to. My work is really not motivated by the paycheck,
Yeah.
which I consider that to be a privilege, but also it really
Sure.
allows me to think about the type of work that I want to do and impact. So
Yeah.
and also there's a lot of uncertainties in our field, and it really pains me when
Yeah.
I see online really highly qualified, credentialed individuals who are really out of work for many months and who have been able to make impactful work in our space. You only know about public
Yeah.
health when things go wrong, but not knowing we are
Exactly.
the ones who are really maintaining the health of this society, ensuring your
Yeah.
air is clean, your water is clean, your health systems are sustainable, are effective, are
Yeah.
working. So we work in so
Yes.
many different spaces and places that I'm again, just trying to think about my next move, where it can be, and I'm very passionate in the cancer prevention work that I'm doing, and
Yeah.
the impact it has, because cancer has really personally impacted my family, my aunt, my cousin who died prematurely, and my grandmother who was diagnosed very late in her life, and she didn't know, and I believe she passed away without even knowing she had cancer. But also knowing my grandmother's story, where because of where she lived, she lost the health coverage, and that really unfortunately she didn't have access to care just because of where she was. So she lost her health coverage, and that makes my work even more purposeful when I'm sitting on this board. That its mission is providing care to those who need it most. It stems from my personal and professional experience to ensure wherever you are, access healthcare is a human right that everyone
Yes.
deserves to have, and unfortunately many have lost health coverage and continue to lose health coverage. But I'm hopeful. We always need to have hope, and hope, what
Yeah.
continues our drive, is we can be innovative to figure out solutions that are sustainable in different to allow individuals to access the care they need, despite all the challenges they face.
Thank you so much for coming on the podcast. I told you before, but I will say it again now that we are recording, that I really I'm humbled by your vulnerability and authenticity, and really am so very glad that you came to share your thoughts about this on the podcast. I really appreciate it.
Thank you so much. Really
And
appreciate it.
yeah, thank you. So I want to make sure that our listeners know the best way to connect with you so that they can learn more about you and your courage. So what is the best way to do that? What's the best way to connect? Is it through LinkedIn?
LinkedIn.
LinkedIn.
I can offer my.
So we'll put your LinkedIn.
I don't know, my personal.
Yeah.
Email.
Yeah. So what we can do is we'll put. I'll put your email and your LinkedIn profile information in our show notes, so people can access it that way and get in touch with you.
Well, thank you.
Thank
I know
you so
we
much
had
for
some
coming on.
little turbulence starting.
Yes, a little turbulence, but we still landed at our destination.
Yes,
the flight was successful. A little turbulence.
And I don't know. I hope whatever I said can, influence others. So we'll thank you for the opportunity and the space to share.
Yeah, absolutely. Absolutely.
Sometimes courage is being the first in your family to walk a new path. Sometimes courage is wearing your hijab, your heritage, and your truth into spaces that weren't made to hold them. Sometimes courage is holding grief and hope at the same time and choosing to keep fighting for a more just public health anyway. If this conversation resonated with you, I'd love for you to stay close to the stories and the courage we're lifting up here. So before you return to your day, take a moment to sign up for the weekly Courageous Public Health podcast email updates. You can go to courageouspublichealth.com. This way you will never miss an episode. There are more powerful, honest, and necessary conversations to come. Thanks so much for being here. And until our next episode, stay courageous. Thank you for listening to the Courageous Public Health Podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how